Hello, everyone, and welcome. My name is Dr. Zoe Wyatt-Portage, and it's an absolute pleasure to be here today. What an honour to be asked to present at the Psychiatry and Addictions World Conference. So welcome. A little bit of context about me before we dig into the topic at hand. I have worked in a clinical capacity for over a decade. I originate from Melbourne, Australia, and I worked as a trauma therapist in Thailand. I did my PhD research in the area of trauma and resilience in Cambodia, spending 5 years living in Southeast Asia. I still work regionally. I'm affiliated with an organisation in Singapore. I conduct therapy online, largely from my new home of Cairns, Australia. I spent 4 years living in Mauritius. So over the last decade, I've worked cross-culture. I have worked with clients from a variety of backgrounds. I've also worked with organisations rolling out mental health programs in the workplace, and there's a development component to the work that I do as well. So that context will be drawn upon in this session to highlight this topic with lots of stories and examples. And I'd like to hear from the group. So at any point, if you would like to utilise the chat function in order to ask a question, please feel free to do so, and there will be time at the end for further questions. I will also pose some reflective questions to the group for you to consider throughout this as well. Because when we start to unpack the neuroscience of essentially habit formation, dopamine, craving, these kinds of topics, there's going to be areas that hopefully you will relate to, possibly in your work, but also in the habits and behaviors that compel us in our personal lives. Let's look at that, and then possible treatment modalities. Let's make a start. So to begin with, what of these behaviours, or which of these behaviours, would you consider potentially addictive? In my work in Thailand, I was as I mentioned, trauma therapist in an inpatient treatment setting. And we were seeing a lot of clients accessing for process addictions as well as substance addictions. And what I thought was interesting with their youth program was that there were far more young people accessing for internet addiction and gaming addiction than what we were seeing in our older community in the men's program. And the women's program, we had an LGBTQ program. We also had an Arabic program. So the clients and the demographic were older, and we were seeing a lot more substance and alcohol use. But the short answer to which one or which of these behaviors are addictive is, in fact, all of them. Because anything that creates dopamine in our brain, we feel compelled to do again. And let's take eating, for example. This is very baseline. If humans were not compelled to eat, the species might die out. So we are rewarded with dopamine for eating. And there are many myths associated with dopamine, but when we start to look at behavioural addictions, it is absolutely central in this. That repetition of a particular behaviour, whether it's through screens or performance metrics. But what we see is that in our modern day, it is rewarded. A lot of these behaviours are rewarded. It is perfectly normal to be scrolling through social media for hours. Whereas when we look at more traditional addictions, it's less socially acceptable to be using heroin. But what we see is, as a result of our modern day life, a lot of these behaviours are left unchecked. There's not as much of a focus, and a lot of them are completely normalised. I work with clients who have identified on their own that their social media tendencies are anything other than normal. And it's often when they see that it's problematic in their life. For example, one of my clients who has ADHD has a relationship with Instagram where it starts to he loses hours of his day. So he chooses to come off the app altogether. So abstinence, essentially, as a form of treatment, because otherwise he feels like he's not productive at work, he's unable to focus, and it exacerbates his ADHD. I have another client who is undergoing a stage in her life, a lot of change, including grief and loss and the death of a loved one. And she's finding that her interactions online are causing her to compare and despair. So she's made a decision as well to stop all social media through this time. But this brings about a sense of autonomy. These examples, these clients have the autonomy to make those adjustments and changes. But what we also see is when clients have identified it's a problem, try to stop and cannot. Those compulsions are there despite the fact it might be impacting on their family relationships, their ability to sleep at night, their overall motivation and drive in other areas of their life. So exactly the same as substance addictions, we start to see very similar patterns emerge. And it is largely due to dopamine. Dopamine has had a lot of attention recently. And in my work with organizations across the globe, I'm often asked about dopamine detoxes. And first of all, the brain always has some level of dopamine there. There's varying levels throughout the day depending on what you're engaging in. So the concept of a dopamine detox is not really a thing, not from a neurological perspective. However, we can certainly detox, as I gave the examples in the last slide, of stopping behaviors that increase those dopamine receptors in the brain. And it's also often thought of as the pleasure driver, but it's more in the anticipating the reward where we have dopamine. So yes, for example, if someone gives you positive feedback or you complete a task, there is dopamine, but there's more of a driver in terms of levels of dopamine in the coming up to finishing that task or when we are anticipating the reward. And this becomes the incentive. And we become more and more switched into is not probably the correct term, but we lean into a particular behavior where we know we're going to receive an award from the brain, essentially. And we get stuck in this pattern and cycle or habit loop. So much of our life is set up on patterns of behavior. I remember when I first started studying in my first year, it was a psychology unit, and they taught us a great little expression that's always stayed with me. Neurons that fire together, wire together. So anything you do once, neurons fire. Anything you do again and again and again, a neural pathway is established for that form of behavior. And so much of our life, we are running in automatic pilot. We've done things a million times over. And an example of this, change the location of your coffee cups in the kitchen. So you come out in the morning, where do you go to reach for? How long does it take your brain to relearn where those coffee cups are? Did you have to stop and think, I need to check my emails this morning when you started work? Good chance you didn't. So much of our behavior has been learnt, reinforced, and is now on automatic pilot. So what happens with these automatic behaviors when it comes to social media and there's that reward and incentive? We have these ingrained patterns. And I was running a session yesterday on doom scrolling, and people were asking, how do I break the pattern? And that example of checking, either it's emails or social media, where is your phone placed? Often, and for those of you that have joined this conference online, where is your phone right now? because I'm smiling when I say this, I imagine that for the vast majority of you, your phone is within reach of you. And this is another completely normalized behavior. There is nothing abnormal with always having your phone in reach, but it also reinforces that pattern of behavior. I need to check what's been happening online. Do I start to feel discomfort when I can't see what's been happening or how my post is doing or how many likes I have? And that automatic pilot makes it really hard to put things down. And one of the small ways of trying to break our behavior is to put our phone in another room. So we have to very intentionally get up, walk across our room to reach for the phone rather than it being on automatic pilot. And most of you will be well aware that the algorithms specifically target and are intentionally designed to bypass our decision-making process. And so we keep scrolling. It links us into the content by providing short little chunks of information. And the brain, in and of itself, is interesting, I find, because we're not necessarily designed for this kind of short sound bites of information that we get. And some of the research in this area points to our inability to access our prefrontal cortex and emotionally reason with logic and complex thought processes what we're seeing because they're such short, sharp little chunks of information. We are more likely to believe that the information is true and accurate as we scroll through because we're not taking the time. I know myself, and I'm sure that some of you in the group today will relate to this. When you look at an article online and you read part of the article, you might stop and consider, is this a reliable source? When you tell me that researchers say, well, what researchers? What are you pointing to? I'm sure there are some of you that are like this. But when I scroll through my video feed and I'm having these short, sharp little chunks of information, I do not take the time to process it because before I've really come to the end of that video, the next one is starting and I'm thinking about something else. So part of our decision-making process is therefore taken away from us alongside of that personalized content. And this can be very problematic depending on what you're looking at. For example, a lot of us in 2020 were glued to our news feeds to find out what was happening in the state of the world. And the term that I used before, doom scrolling, that essentially came about in 2020 because we were scrolling for doom and gloom. I remember at that time, many of my therapist friends came off social media altogether because of the nature of their news feeds. They were finding it quite distressing. And I've also found that since that point, looking at what the research is telling us, many of us are still very much locked into content of a distressing nature. It might be geopolitical situations in your region. There can be lots of things that the brain requires more information about because our threat response has been triggered. And I find that really interesting because it dates back to well and truly before social media. Back in the 50s and 60s, the term "if it bleeds, it leads" was created to talk about how the front newspaper or the front page of the newspaper was a tragic story that people could connect to. But that connection is our stress response. That could happen to us, that could happen to someone we love. That's awful. We need to know more. And that in a modern day context is doom scrolling, except once again, those short, sharp pieces of information with content again and again and again can cause a lot of distress. And that's very much reinforced. So the compulsive engagement is mimicking the same mechanisms in the brain that we see with other forms of addiction like gambling. And I'd like you all to reflect on your own online behavior. Have you lost track of time? Smile when I say that because I feel like the vast majority of us might have. I tried TikTok. I didn't really enjoy that, but I do like to look at cat videos. So on my Facebook videos, there's a mix of things that I like to look at, and all things cat videos make me smile. So it's very easy for me to be looking at a mix of politics and cat videos because of those algorithms. Some of us might be more strategic and think I'm just going to have LinkedIn. The younger generation, I hear from parents around the world how they do not allow their children to use Facebook and Instagram and have pages, but they allow YouTube for educational purposes. But then their children are still finding content on YouTube that they don't find particularly appropriate. So what we're seeing is that it starts very young. And I find that a lot of the clients that struggle the most, not always, but in my experience, Gen Z, because they are digital natives, can be affected by this. As I'm Gen X, my childhood was analog and my teenage years were digital. So I didn't necessarily grow up from a very early age with this kind of information at the touch of a button. Now, these days, we just Google everything to find what we need. But within this, that automatic pilot, that sense of immediacy, I need to know, I need to have it now, let's go, 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 is affecting Gen Z's ability to communicate and to sit with even a conversation that goes on too long. And I find that really interesting in some of the research when it's pointing to the influence of how we digest information and what's been normalized. So let's look at this from a bit more of a clinical lens. And the DSM-5 I operate from, and a lot of clinicians that are present at this conference will be operating from these manuals. Now, the DSM-5 is an ever-evolving document that is focused, yes, in the area of addiction, of course, along with all other mental health issues, but there's no formal criteria for these types of addictions. Now, I mentioned before that addictions have similar consequences. So we see that that can be a way of identifying what is the difference between problematic behavior and addiction. It's often very similar. Can that person stop with their free will? What happens when that person tries to stop? What is occurring in someone's life outside of their use of whether that's alcohol or a social media use? So, what are the consequences? So, when we look at those kinds of patterns of behavior, the functional impact and the distress, so what is occurring in someone's life, that helps us decipher this. But it's an area that very much needs more focus so we can have clinical diagnostic tools that enable us to really understand perhaps how it differs from other addictions. Another area that I find really challenging is how it's socially rewarded and completely normalized. One of my clients is a marketing manager, and as a result, spends a large portion of her work life on various social media apps. But on top of that, she spends about 3 hours of her personal time every day on top of her workload on social media. Now, that is a huge amount of time. And Statistica has some really interesting, as the name suggests, stats that we can draw on. So, according to Statistica, we as a globe spend about 143 minutes a day online. I still find that to be quite a lot. And for people who it's been completely normalized, the younger generation, people use it for work, and then it starts to tip into what am I doing outside of that? Do I have balance in my life? And a lot of people believe that it's normal, so they might not reach out when they start to see those issues and problems that are occurring. And being constantly accessible, being switched on, this has been totally normalized. I work with some very successful clients around the world, and this is often a topic of conversation. And for those of you within the group that work internationally, like myself, sometimes my hours are a little interesting. One of my affiliations is based in the UK, so I have a flurry of emails relatively late most nights, which I always answer because I feel like it's part of my role to get back to people in a prompt fashion. But what happens there is I find that even I don't necessarily have boundaries when it comes to my work. I also like to be available to clients, and they're all in different regions. So that is completely normalized by society and by my life. But when we look back at the 50s and 60s and the time before the internet, people had a definitive line between their work and their home. So they would come home, it was family time, they were able to switch off. Whereas the vast majority of us are never switched off. From the second we are awake and conscious in the morning, we are checking, rechecking, responding, answering. We are better connected than ever before, but in a lot of ways, we are less connected than ever before. Because how many times through the point of your day are you sitting down with the people that you love, you care about, looking them in the eye and having a conversation and not checking your emails or your phone? So when this starts to become an issue, it often hides in plain sight. And I'd like you to consider your culture and what kinds of behaviors have been normalized. I've mentioned the differences sometimes with age and how that might play a factor, but also how much of our life is online and how that in and of itself might pose issues as well. I mentioned the term compare and despair before, and for many of you, you'll be aware that there is a definitive link between social media use and mental health disorders such as anxiety and depression. And what we see is that humans are hardwired to belong and to connect. And that is critical for our very survival, safety in numbers. So when people say to me, oh, I don't care what anybody thinks, my response is often, I'm thinking, really? No one? Because often we are hardwired to very much care. But how does that translate? Instead of it being, I care what my family thinks and my immediate friendship group and circle and community, my community now might be 9,000 people across multiple social media apps. And then it's the narrative. The influencer phenomena of, well, for me, I'm interested in health and fitness. So I'm constantly seeing content that involves these 3-hour processes of organic food and how we all need to work out like this in order to look like this. And this can be very damaging when someone has a low self-esteem, when someone is feeling socially isolated from their peers. This might be a way that they feel like they're connecting when in actual fact, it's the opposite of. And children these days are having access to this at younger and younger, and it is causing problems. So how do we go about treating something, particularly when it's unseen for a period of time? In my experience, people don't access therapy until they have gone through that process of I've tried to moderate, I've tried to quit, exactly like what we see with other addictions. And they've come to a point where they can't manage. And so when I meet a client, for example, I don't necessarily just pick one modality and run with that. And for those of you in this conference with a clinical background, I'm assuming a lot of you have that, you might have your modalities that you like to draw from in your own practice. And I don't believe there's a one size fits all for treating addiction. or any other kind of mental illness. I feel like people are unique, and the more tools in the toolbox we have as clinicians, the better we're able to support that individual. And sometimes it's through trial and error. So, for example, CBT really looks towards the thinking and tries to disrupt those automated behaviors by the thinking that leads to the feelings that leads to the behavior. So, really looking at that thought process and those patterns of behavior. Mindfulness-based interventions, I think, are excellent in terms of slowing down that thought process. And this can be utilized in conjunction with other types of therapeutic processes. That being said, however, one of my clients, when she first came into therapy, she said she downloaded all of these apps and was doing all these breathing exercises and doing yoga every morning. And she said, but it's all on YouTube and all of the other apps that she was using. So she was finding that it was still causing her to check. So she would have her phone next to her while doing yoga and would still pause to check to see what was happening online. So working with a client to find out, well, what have you tried? What's worked for you so far? And what can we do that's different to disrupt the processes? Because that's essentially what we're really looking to do. And one of the areas that I see very strongly with another one of my clients who, when I met, was really socially isolated. He'd worked internationally for a number of years and he was never in the one place for very long. And as a result, he had friends, but they were scattered around the world and was less connected in every place that he would go to, spending a lot of time on his own. And he would see his social media usage increase dramatically to the point it was affecting his work. And so coming back to those values and understanding the why, and also looking at how can we stack in the other direction. And of course, within the addiction literature, connection is a powerful tool. Social connection is paramount. We know that loneliness and isolation exacerbate all mental health issues. So that's an area that can be incorporated, looking at a psychosocial assessment and thinking, well, who is around this individual? And what can we do to strengthen some of those connections or perhaps start new connections? So CBT in practice, social media overuse is driven by those distorted cognitions. So FOMO, fear of missing out, that comparison, and also doom scrolling that I mentioned before. It's catastrophizing. We see those cognitive distortions emerge. I need to be online. One of my clients said to me at one point, if I'm not online, how do I know that I matter? And she smiled when she said that. She was joking around, but I thought that's actually very true because so much of our world is online in a very, not for all of us, but for some of us, in a very fabricated way. Because if I ask my client, is Facebook an accurate representation of someone's life? I'm going to hear, no, of course it's not. We know this logically, but does the brain, when we're scrolling through pretty pictures of a European holiday and someone's had a child or has bought a new house, has gotten a promotion, and we're sitting there thinking, I don't have any of these things and I'm alone, and it exacerbates mental health. So how do we then give a little strategy? So I like this one where a client might log in every so often and then also see what happens when there isn't that use and what can we replace it with? What are some other activities that that client enjoys, hobbies, interests, and of course, any kind of movement is excellent because of our neurochemicals. So mindfulness-based interventions, we might have, much like mindful eating, we can mindfully undertake activities in our world. And mindfulness builds up the tolerance for discomfort. So noticing the sensations, naming it, we can journal it as well, or we can just slow that process down. And this slows down that automatic pilot way of going through life. And it can be really challenging to start with. I also see that clients feel agitated, and this is also a calling card of addiction. What happens when they can't access? They start to feel agitated. So practicing mindfulness in those moments can be really helpful. And with gaming addiction, or I would argue any kind of addiction, it can be a direct result of, I mentioned, loneliness and isolation. It can be a direct result of trauma. It can be underlying mental health. It can be what we see as a reaction to. And we need that understanding of what's underpinning the behavior. Because without that, if it is emotional avoidance, for example, what is the emotion? We need to confront that. Otherwise, it's going to likely, not always, but likely crop up in other areas of our lives. And so I see, particularly with addiction, is that the term addiction is more all-encompassing. We see that people who are in recovery have a higher they have addictive tendencies. So they might be in recovery from substance and then pick up online behavior that becomes compulsive. We might see that someone who is also puts down alcohol picks up food. We see that people might have addiction, or this is definitely a non-clinical term, but it's like that game of whack the mole. You smash it down somewhere and it comes up somewhere else. And that is often how people in recovery feel, because the addiction is what we can see. It's everything else that's going on underneath the surface that is promoting these kinds of behaviors. And some people are more susceptible to this than others. So lots of different techniques, depending on where that individual is in their lives, how difficult it has been for them to manage. But those behavioural triggers are often environmental. So being able to increase the autonomy, and what I really like is to test things out. I also appreciate the neuroscience habit stacking tendency. So I would never say to a client, let's have a list of 10 things for you to implement tomorrow, because this is too much. What we want to do is choose one, test that out, and try to stack small habits on top of the existing habit rather than changing everything all at once. And particularly if the pattern of behavior has been ingrained for a really long time, this might be challenging to shift. So looking at the client from a strengths-based model and saying, well, okay, how are we as a collective team going to approach this? What strengths are you bringing to the table? What have you tried already? What can we learn from that? What can we take from that? So instead of seeing, I hear clients talk in absolutes a lot. I failed. Really strong words, instead of looking at, well, this is a learning experience. What do we take from this attempt moving forward? And another reflective question from the group: what personal habits have made you reconsider your relationship with digital tools? For me personally, my husband commented on me checking my phone for emails. I'm less inclined to be on social media, perhaps because I'm Gen X, but very much in tune with my work. And he said to me that he felt like he was coming second after my work. And that made me consider, what's my relationship with my phone? Can I not have that around me during times where I am spending quality time with someone I love? And so for those of you that are in this conference right now, here today, having a think about, what is my relationship, and are there adjustments and changes that I'd like to make? So in conclusion, there's no such thing as a better or a worse addiction. Addiction is addiction. And when we see the behaviors and the consequences being very, very similar, I would not be arguing that a drug addiction is in any way worse than a behavioral addiction. And the absence of these substances doesn't mean the absence of harm. These behaviors arise as a way to suppress emotions, to cope, to ward off boredom. It can be something as innocent as I use the example of cat videos, watching cat videos, but then finding that that is keeping us up at night until 2 a.m. when we're getting up at 5 a.m. to go to work. We start to see those behaviors become just as problematic in someone's life, and it can hide in plain sight. So treatment is not necessarily about abstinence, but by coming back to that sense of agency, utilizing a strengths-based model. And as clinicians, researchers, and educators, we need to keep looking at this and exploring this and help to rewrite how we're approaching behavioral addictions. So just finally, before I open up to questions and comments, I have written a book. A book. Not quite. I'm in the process actually of writing a book, and this is one of the topics. But I've written an academic article which is available on my ResearchGate profile. So for those of you who would like to read some further information, please feel free to connect with me via LinkedIn, my webpage, or either ResearchGate as well. And on that note, thank you all so much for listening and participating today. And I hope you got something helpful and useful out of it. Take care, everyone, and bye for now.